Good morning, this is Dr. Paul Goldberg speaking to you from the Goldberg Tenor Clinic in Tyrone, Georgia, just outside of Atlanta. Today, I'm happy to present to you an interview with Dr. David Tenor, the director of the Goldberg Clinic, and Miss Rose Reichart, who came to see us from Wisconsin about 18 months ago. Rose was suffering with a severe case of hives and asthma, and she had been enduring this all the way since infancy. And she had been treated with treatment after treatment of steroids and other drugs, leading to a life that was very much impaired and quite miserable for her. About 45 years ago, I developed, in light of the fact I had been suffering from rheumatoid arthritis myself, a system called the Goldberg Clinic Biohygienic Recreation System. And using that on myself, I was able to reverse my chronic disease. And I set forth after that, after many years of education and clinical experience, in applying the Goldberg Biohygienic Recreation System to other people. And today in the interview with Dr. Tenor and Ms. Rose Reichart, you'll see how this was applied to Rose, leading to her transformation from chronic disease to excellent health. You'll see a series of before and after pictures as well as the interview, which will demonstrate Rose's complete transformation into much, much healthier situation and a much happier life.
Hi, this is Dr. David Tenor. We're here at the Goldberg Tenor Clinic, just outside of Atlanta, Georgia, and we specialize in the reversal of chronic disease, and I'm delighted to be joined today by Ms. Rose Reichart. Rose is from Wisconsin. Yes, what part of Wisconsin?
Milwaukee.
Milwaukee. And Rose came to see us back in August of 2018. It is now about 18 months later. We are in March of 2020. And Rose came with some pretty severe health issues. Actually, one of the more severe cases I've seen in the 10 years I've been here. She had severe hives, asthma, and allergies. Mm-hmm. And not only did she have one of the more severe cases, but she's had one of the more remarkable turnarounds. And I'm very thrilled to have her here to present the changes and the improvements that she's had. So Rose, walk us through your history. When did this all start?
So this all started when I was 13 months old. I'm 36 right now. My mom told me as soon as I got off of, she was done breastfeeding me, went on to regular food. That's when everything started. I was reacting to dairy, and I was getting allergic reactions, and they were hives, and that's when the hives started.
So this all started when you were a very young child?
Yeah, I don't remember.
And it's progressed all the way up until into your 30s. Mm-hmm. You're now 36. Mm-hmm. Yes, okay, so Rose had a rough start with asthma that had gotten progressively worse. Just looking at some of your history here that we took at your first visit, your hives at one point, looks like at 13, had become uncontrollable, and you were hospitalized many times for asthma as well, correct? Yeah. And what were they doing medically with you all that time?
Just constantly putting me on medications to control everything.
And what drugs have they put you on?
Prednisone, I remember being on and off of that all my life, along with antibiotics, because I was constantly getting sinus infections too. Okay, so they were suppressing infections you were having, killing off bacteria, and they were also giving you immunosuppressants, prednisone. Mm-hmm. When Rose came to see us in August of 2018, she was on 9 medications at the time. You were in really rough shape, and just show some of the pictures, we'll splice them in, of just kind of the disabling symptoms Rose was having at that time. She was on prednisone, Advair, albuterol, Singulair, Flonase, Yasmin, clonazepam, cyclosporin, and Xolair injections. Mm-hmm. That's quite a cocktail of pharmaceuticals. And they, sorry, not to interrupt, but they also wanted me to start a new drug where I'd inject myself every day, and that's when I was like, no.
No more.
No.
Rose, you had seen a number of different specialists who were trying to help you. Tell us a little bit about that.
I've been seeing an allergist all of my life. But the latest one that I was seeing, I started seeing him because my old one retired, and they referred me to him because he was known as the Hive doctor.
Well, he was the guy to see.
Yeah, he was the guy to see.
Specialist. And what did he tell you?
Pretty much, it was controlled because the Hive started up again. They were controlled, and then they didn't start up again until June of 2014, and we got under control with Xolair.
Mm-hmm.
And then back in January 2018, that's when the Hives started coming back, and they were out of control, and they started to increase the Xolair. Instead of once a month, it was once every 2 weeks, and then it wasn't working at all, so they started trying to put me on other drugs on top of that, and it was not working.
So just a bevy of pharmaceuticals, and as I recall, they at one point they said they weren't sure what else to do with you.
No, that was the worst case they've ever had.
You were the worst case that they'd ever seen.
Yeah.
And this is the Hive doctor, the guy who sees people with hives all the time.
At Children's in Milwaukee.
At Children's Hospital in Milwaukee, you were
Yeah.
the worst case they'd ever seen. And look at some of the pictures of Rose. I believe it. I mean, she was in really rough shape. How had that interfered with your life and your ability to function, all these hives that you were having?
It interfered a lot. I just, I couldn't be out doing just my normal life, my job. I was a full-time kickboxer instructor, and with working out, we wear tank tops and, not a lot of clothing, obviously shorts or leggings and stuff like that. So I couldn't show my skin or anything. I was hiding under clothes like that. I had that, I couldn't be around people.
So Rose came in August of 2018. We did a thorough evaluation on her, and then Dr. Goldberg and I developed a program for you to follow. And we've been following up with her since, somewhat over the internet, via email.
Yes.
And she's come for visits to see us every 3 to 4 to 5 months or so for follow-up. And this is her 18-month follow-up. How much improvement have you had overall? What did you write down on your sheet?
I wrote down I'm at 90% now. I feel like 90%.
How many hives? When's the last time you had any hives?
September, so 6 months ago.
Okay, and you're on how many drugs now?
Just one, maybe two, 'cause that's if needed, albuterol.
And you started out on 9 of them a
Yeah.
year and a half ago, and we're hoping that gradually over time Rose will be less and less dependent on those last 2. We have a good feeling that she'll be off them soon enough. But that's quite a load of pharmaceuticals now off your system. You're not having any hives. You can see that in the after pictures, some of them that we took today compared to what they looked like before. Absolutely remarkable. So Rose at 36 now is turning her life around. She's back at work, yes, functioning. Yep, working again, feeling good. About 90% improved, and compared to where she was 18 months ago, that is a tremendous achievement and accomplishment. So Rose, thank you for sharing your story. We appreciate all your effort. You've certainly earned all these improvements, and you're well on your way.
All right, thanks.